protein requirements for dementia patients. As the number of older people grows rapidly worldwide, and elderly people living longer, dementia is becoming a greater public health problem. Dementia is the most common cause of cognitive impairment. It is prevalent in 5% of people over the age of 65 and up to 50% of people over the age of 85. Dementia is a general loss of cognitive abilities, including impairment of memory as well as disturbed planning, organizing, and abstract thinking abilities. There are many causes of dementia. Dementia syndrome is completely reversible, but the vast majority of dementias like Alzheimer's disease and vascular dementia are not reversible. 1. Alzheimer's disease is the most common form of dementia. Vascular dementia, sometimes known as multi-infarct dementia, is deterioration in mental function caused by strokes. Multi-infarct means that multiple areas in the brain have been injured due to inadequate blood supply. Pick's disease, Huntington's disease, and Parkinson's disease can also lead to dementia. The other common cause of dementia is excessive alcohol intake, due both to the direct neurotoxic effects of alcohol and to the effects of alcohol on nutritional status. A significant correlation has been found between risk of dementia and high plasma levels of certain amino acids, which are the building blocks of proteins, and low levels of some vitamins like folic acid, vitamin B6, and vitamin B12. High blood levels of an amino acid known as homocysteine signal a breakdown in some vital processes in the body, resulting in far-reaching biochemical and life consequences. Information has been emerging regarding a connection between homocysteine metabolism and cognitive function, from mild cognitive decline, age-related memory loss, to vascular dementia and Alzheimer's disease. Significant deficiencies in vitamin B12, folic acid, as well as vitamin B6 are commonly seen in the elderly population, with a resultant increase in homocysteine with advancing age. Indirect and direct vascular damage can be caused by homocysteine, which has been implicated in vascular dementia, with an increased risk of multiple brain infarcts and dementia as homocysteine levels rise. 2. Nutrition plays an important role in the aging process, and knowledge about nutrition-related risk factors and cognitive impairment is accumulating. Subclinical deficiency in essential nutrients, antioxidants such as vitamin C, E and beta-carotene, vitamin B12, vitamin B6, folic acid, and nutrition-related disorders, such as hypercholesterolemia, hypertriacylglycerilemia, hypertension, and diabetes could be some of the nutrition-related risk factors, which can be present for a long time before cognitive impairment becomes evident. A curative treatment of cognitive impairment is currently impossible, but drug therapy if started early may slow down the progression of the disease. However, there is a possible link between nutrient intake and cognitive impairment that may inhibit or delay the onset of dementia. 3. Patients with dementia are at risk of developing protein-energy malnutrition because of poor food intake and increased energy requirements. Diet may play an important role in the prevention of multi-infarct dementia through effects on blood pressure and other risk factors. Control of risk factors may also prevent further progression of the dementia. Patients with multi-infarct dementia often have difficulty in swallowing, dysphagia. Dietary supplements containing proteins like whey and casein can be of benefit in elderly patients suffering from dementia as they are unable to eat independently and consequently threatened by malnutrition. Casein is a milk protein and has the ability to form a gel or clot in the stomach. The ability to form this clot makes it very efficient in nutrient supply. The clot is able to provide a sustained slow release of amino acids into the bloodstream, sometimes lasting for several hours. 4. A protein supplement containing casein can thus increase the amount of energy assimilated from every meal, providing adequate nutrition. Alcoholic dementia may also be partially reversible with abstinence and good nutrition containing proteins. 5. In the human body, some harmful byproducts are formed due to the normal metabolic oxidation reactions. The accumulation of these highly reactive molecules, free radicals, is one of the major factors that cause damage to the neurons in the brain. Protective molecules called antioxidants are involved in the prevention of this cellular damage. Even though endogenous antioxidants have a role in the prevention of this damage by free radicals, dietary intake of antioxidants is also vital. Whey protein contains an ample supply of the amino acid cysteine. Cysteine appears to enhance glutathione levels, which has been shown to have strong antioxidant properties that mop up free radicals that induce cell death and play a role in aging. So whey proteins can have protective effect on neurons when taken in long-term basis. The dietary intake of antioxidant vitamins A, C, and E may influence blood levels of catalase, which is an antioxidant enzyme, possibly through their effects on free radicals. So there is a definite role for antioxidant supplementation in the treatment of dementia disorders. In addition, whey proteins and caseins also contain caseokinins, and lactokinins, 6, which have been found to decrease both systolic and diastolic blood pressure in hypertensives, which is a major risk factor. 7. Folic acid, vitamin B12, and vitamin B6 are shown to be helpful in reducing the blood level of homocysteine, which is implicated as one of the major risk factors in the development of different types of dementia. Providing the nutritional cofactors for proper functioning of the essential biochemical reactions of the body may protect the brain from damage. In all types of dementia, adequate nutrition may improve physical well-being, help maximize the patient's ability to function, and improve the quality of life. Patients with dementia, who frequently have feeding problems and require supervised and assisted feeding, will benefit from protein supplements and specific water-soluble vitamins, folic acid, B6, and B12. The antioxidants can have a neuroprotective role. Thus, development of a protein supplement containing casein and whey can provide an apt high-protein diet and direct health benefits to individuals suffering from dementia.